Well, hello everyone and welcome to this Health at Sea and to our fantastic passenger trust after COVID-19 webinar. Ladies and gentlemen, my name is André Noël Chaker and I have the pleasure of being your host today. As you can see from the agenda on the right of your screen, we have 4 of the top speakers about various issues that will relate to the future of the maritime industry speaking to you today. We also have an objective today, and our aim is to give you ideas and potential solutions to face the challenges the industry will be facing over the next few years post-COVID. We'll also be highlighting some of the unique solutions and unique contributions of some Finnish institutions and companies to the industry. We want this event to be as interactive as possible. And to do this, we'd like you to use 2 hashtags, and they will appear hopefully on the screen, and they are hashtag Health at Sea and hashtag Finland Works. So hashtag Health at Sea and hashtag Finland Works. We also encourage you to put in your questions and comments in the area below the feed screen. These are questions you can pose to the speakers or just general comments that we can then use when we interact with our keynote speakers throughout our event today. And I would like to thank all of our great people out there who have told us already from where they are tuning into, and they are tuning into the event from Shanghai, Ottawa, Oulu, Hamburg. A lot of people from Shanghai, New Delhi, Espoo, from Denmark. People from all over the world are now tuning into this very important event, this webinar that will talk about health at sea and also talk about passenger trust post-COVID. Ladies and gentlemen, we have polling opportunities. We'd like to know what you are thinking right now about the challenges facing the industry. So we have our first poll. The first poll is, as I mentioned, for those people who tuned in early, is going through the menu that is right beside the words Business Finland. You go to the menu, you scroll down, and you see polls. And I'd like you to go to polls, and then there's a specific kind of poll called the word cloud. And for this, I would like you to tell us in 1 or 2 words, what is the main challenge you are now facing? What is the main challenge you are facing right now? Is it a supply chain challenge, a finance challenge, a health and safety challenge? So 1 or 2 words, and we should be able to produce. And I'll be refreshing my word cloud. So 1 or 2 words. Tell us now, what is the challenge you are facing, or the biggest challenge you are facing right now? This event is jointly organized by Business Finland and the Finnish Marine Industries. And the inspiration for this event is that we still know very little about the COVID virus. But we do know some things. And we have invited some of the best people to tell us from various points of view, whether it's computational physics or epidemiology or EU policy, how these areas can help us move forward and survive as an industry. So, ladies and gentlemen, here are some of the early results. The things that are now troubling people are travel ban, public health, health and safety, uncertainty health. Yes, health and safety. That's great because we're going to have a lot of health and safety experts coming to speak to us today. So I think we'll be tackling a lot of these concerns during the event today. Thank you for participating in our first poll. And now, ladies and gentlemen, I'd like to also tell you that for those of you or your colleagues who are not able to watch this transmission or watch this webinar, you will have an opportunity to watch this later. This will be made available to you. We'll be sending you email with a link to this event to watch it again if you want to get the extra insight, or for some of your colleagues that didn't have a chance to attend today, this great material will be available to you in the near future. So now, without further ado, I'd like to ask the head of Smart Mobility here at Business Finland to join us on stage. Ulla Lainio, welcome.
Thank you, Andre. Dear audience, health and marine professionals from all over the world, welcome to the Health at Sea seminar organized by Business Finland and Finnish Marine Industries Association. As Andrea introduced me, my name is Ulla Lainio. I'm heading the Smart Mobility program, and also I'm heading the Marine and Port Industries at Business Finland globally. So Business Finland is a governmental company in charge of innovation, export promotion and invest in activities. So those companies who are abroad, who want to establish presence in Finland, we are here to help you. Finland has very strong industries such as health, marine and digitalization. Finland is able to react to the changes in the world market very quickly and support companies in an agile manner. So you may think, why is Finland organizing this kind of webinar? It is because marine, health and digitalization industries are very important for Finland. Marine industry alone makes about 10% of all exports from Finland. So why Finland? Some words about the Finnish technologies. Firstly, Finland designs about 60% and builds around 1/3 of the world's largest cruise ships. Finland has built about 60% and designed about 80% of all the icebreakers in the world. And that is one of the top-notch technological know-hows in Finland. And then what comes to marine autonomy, Finland is one of the leading countries in the world in marine autonomy and a pioneer in applying artificial intelligence to autonomous operations. Finland has demonstrated the world's first remotely piloted passenger ferry. And in addition to that, Finland is home to 1C. That is the world's first test area for autonomous maritime operations on a commercial basis. Finland has also launched the world's first commercial 5G network. Finland has world-class research and technology in the health sector and one of the most efficient healthcare systems in the world. Now, we have the pleasure of bringing these same technologies also into the marine industry. Today my presentation is divided into two parts. I'm ending my first part now, and it's time for professionals' presentations. Thank you very much, and we continue.
Thank you so much, Ulla. And that robot ship, the first AI autonomous ship, is something that's particularly close to my heart. What great breakthrough technologies we have from this country and from this area. But ladies and gentlemen, the work of our first keynote affected many lives during the pandemic. He is a computational physicist, and he has studied fluid modeling research with his group at Aalto University. His talk will be about modeling the airborne transmission of the virus. And the modeling and visualization of what he's done has certainly affected many of us in this region. I know that as soon as I saw that, I knew to stay away from crowded places and wear a mask during the entire pandemic. So I am personally grateful to our first keynote, ladies and gentlemen. Please welcome Professor Ville Vuorinen. Tervetuloa. Welcome.
Okay. Thank you. And nice that you're all joining us today, and thank you for Business Finland for invitation. Indeed, my name is Ville Vuorinen, and I work as a professor at Aalto University, and I will talk about the publication that we prepared this spring. So some work that was carried out in between March and May 2020. And I'm presenting about the publication in the Safety Science Journal and on behalf of the COVID-19 task force formed by 5 organizations in Finland: Aalto University, Finnish Meteorological Institute, VTT State Research Center, University of Helsinki, and CSC Center of Scientific Computing. So here is the paper. It was published in Safety Science a few weeks ago, and it's about modeling aerosol transport and virus exposure with numerical simulations in relation to SARS-CoV-2 transmission by inhalation indoors. So we are focusing on inhalation only and modeling something that's called airborne transmission. And I'm extremely grateful for my 30 co-authors listed here. This is a multidisciplinary effort. I think we are, as a consortium, quite unique in worldwide as well, and also doing a rather timely research, I would say. So let's think about where did this kind of all start from. So transmission types. We have been hearing about safety distances of 1 to 2 meters and so on. And this is all about droplets. So when a person is talking or coughing or sneezing, these droplets that are produced from our mouths, they are traveling in the air. So there is an airflow problem and droplet dispersion problem. And essentially, depending on the size of these droplets, so whether they are small or large, the characteristic behavior will be quite different. So we talk about droplet transmission, and that's mostly when the large droplets, we talk about something that you can typically see by your naked eye. They are going out from the mouth and they are falling down within a few meters perhaps from the person. While when we are talking about airborne transmission, we are talking about smaller droplets that are produced by speaking, for example, or coughing. And that's when we start talking about aerosols as well. So these small droplets, they will dry quite quickly into small particles that can carry viruses. Not all aerosols carry viruses, but part of them do, probably do, and they will also travel a much longer distance than the larger droplets. So airborne transmission versus droplet. And as a remark, airborne has a very notorious tone, I would say. It's a scary word, and while, let's say, for engineers, it's something that we talk about quite casually. But let's say when we talk about epidemiology or medical sciences, airborne diseases, transmitted diseases, they are associated with measles and highly contagious diseases. But anyways, our focus is here on airborne transmission. And to put this into some kind of context, okay, where did this all start from? Like COVID-19 was approaching Europe, was approaching Finland. We were kind of prepared, but still it came as a surprise. And what the health authorities across the world, they were mostly emphasizing, I would say, hand hygiene and the safety distance. I think these are both very valid topics still nowadays. But anyways, it was not so much about, there was not so much talk about airborne transmission. We didn't probably even know what that was or had ever thought about it before this. How these diseases are actually transmitted. How does even influenza A, how is that transmitted? And now we are talking about something which is completely new, like COVID-19, the new coronavirus. And for example, World Health Organization was giving these tweets where they were declaring that COVID-19 is not airborne. So a while later, this tweet was taken away. It was not there anymore. And and I think that this is still an open question whether or not one can get it as an airborne transmitted disease. But after a short look into literature, WHO documentation, several publications, some pen and paper calculations on droplet size, properties, actually we noted that there are various open questions. We know actually very little about what are the sizes of these droplets and how do they actually behave in air. Are they falling down in your immediate vicinity or traveling a longer distance? So the possibility of airborne transmission, it actually seemed to be highly unclear. That's what we realized in March. And that's also what took us to our consortium. On March 21st, this multidisciplinary consortium was established in Finland. And we contacted our organization heads and they contacted different researchers in these organizations, and we decided that we want to understand, is COVID-19, is it airborne transmitted or not? And the fields of science that we are working on is 3D airflow physics, so how the air is flowing, aerosol simulations, so we are talking about 3D, quite high fidelity simulations, so something that's used in aircraft design, aerospace, and naval architecture as well, hydrodynamics. So this to study how a person is coughing. And virology and chemistry, medicine is all involved in our consortium as well. So we have medical doctors, virologists, and so on. And this is a supercomputing topic. We want to simulate how this coughing, how these droplets are dispersing. And of course, the relevance is that safety distance alone may not be a sufficient measure in this case. If we talk about aerosols, then they can travel long distances, they can accumulate in spaces and so on. And to go into our literature survey, what we did in our publication, we looked into coughing-related literature. What we noted that actually from coughing, there are significant numbers of droplets. Even majority of the droplets, even volume-wise, can be in this aerosol regime. So that either they are readily very small or they evaporate very rapidly into small particles which can carry viruses. So just based on the literature, we can say that actually when we talk about COVID-19, SARS-CoV-2 virus, it seems like that there is a high relevance, something that we cannot just overlook in our considerations when talking about safety and protection of people. Something that can linger in the air for longer enough time, and this at least looks like feasible if we talk about dry cough, for instance, influenza A transmission, or some other diseases. For other diseases, this seems to be typical that the droplets are in the aerosol regime. There are also lost droplets. Probably there are also lost droplets. So these are kind of it's not black and white, but it's kind of like a continuum range of droplet sizes. And what are we talking about when we talk about aerosols? We talk about something that's traveling in air, so it's a fluid mechanics problem. There is turbulent flow, the air is moving and swirling. It's a very similar problem as for instance, smoke dispersing in air. So in a similar way, these small aerosols, they will be mixing in airflow, and it's like cigarette smoke traveling from here to there. And one of these things, the observations was that indeed, if we talk about droplets as large as 100 micrometers, which are pretty large already, even those droplets have the possibility to dry into smaller ones so quickly that they can remain airborne for minutes or even longer times. When we talk about like a micrometer scale droplets, these will basically stay really long time in air. We talk about hours or until, in practice, ventilation is kind of removing them. So let's look at an animation how this actually looks like. So the simulation is indeed showing how droplets of different sizes, they are moving in indoor air. And what we see here is the blue and the red droplets, which are kind of highlighted. We are spotting out and following only a few of them in this big cloud. And indeed, these red ones, they are the largest ones. And as you can see, they are falling down on the floor. And while the blue ones are below 10 micrometers in this case, and they are mixing around like the smoke. And indeed, part of these droplets can carry the pathogens such as coronaviruses. And if somebody is inhaling them in large enough numbers, then they risk infection. And this one, the next animation, it's about coughing in a public space, like for example a corridor of office space or a supermarket. And what we see here is that these droplets are dispersing in the airflow. And indeed, the red area is a so-called domain of elevated risk. So that's where we consider that the exposure time would be particularly short to inhale large enough numbers of these droplets. And this was actually the video that went viral. It was viewed by about 1 million times in YouTube and displayed on BBC and so on. And the last type of modeling that we were doing is Monte Carlo simulations. We are modeling green, the healthy ones, and the red ones who are infected, traveling in public places. And we are basically varying in our publication the number of persons in this area and number of infected persons, the fraction of the infected ones, and analyzing how they are releasing aerosol while they are walking. And these yellow plumes, they represent coughing. So you can see that one key learning from our simulation is that the infected individuals, they should definitely stay at home. They shouldn't be going to public places because that really elevates the risk. And what we did was that in our publication, we looked into publicly available media cases, and we noted that the persons who actually have got COVID-19 from Finnish media, so this is not publication data, but it's from media resources, these persons, they have probably been exposed to 100 to 1,000 aerosol particles by inhalation. So by combining literature data and data from these media sources, we estimated that this seems to be a trend. Another way of saying is that they have spent long enough time in closed rooms together with other persons. And it's not a definite number, but that was our estimate. And indeed, a result on the safety distance, we defined this domain of elevated risk for aerosol transmission. And this certainly is not an absolute measure. Here we see 4 meters. But these can be traveling as far as the air, ventilation is taking them, and basically what is really a domain of elevated risk? It depends on how contagious disease we are talking about, so and various other aspects. And indeed, this one I discussed already. So infected should stay home. Person density matters. Residence times matters. Ventilation matters, many commonsensical things matters, human behavior, what the humans are doing in practice, how they are interacting, that's important. Loudness of speaking, how loud you're speaking, and mode of motion actually matters, which was kind of a surprising, but it's kind of like clear as well, that if you're stagnant next to other ones versus if you're moving, passing by just for a short period of time, that kind of changes the trend that we see from like the exposure to aerosols. So we are looking at these matters. Aerosol exposure is what we are talking about. We are not simulating any particular virus, but we are kind of like discussing this in this present pandemic context. And finally, a result on aerosol exposure from our paper. So what we proposed was a theoretical model that explains average aerosol exposure by inhalation. So it's basically let's say a simple equation which tells you how many particles you have per cubic meter of air if you have sick persons in a room. So it depends on the volume of the room. Are they speaking? How loud they are speaking? Are there coughing persons present or not? The ventilation timescale, how many times per hour is the room air changing, and the number of persons in the room, and so on. And indeed, from these we can estimate the number of inhaled aerosols the person is on average inhaling during a residence time. So the longer you stay, the more you inhale. And what is nice is that now we have some basic things that many authorities are already telling, but we have them in a compact equation, and we can kind of use this already to make predictions on average human exposure. But of course, average exposure is different from what the most exposed persons are feeling. So actually, this is when it comes to the human behavior. What the humans are doing in practice also matters. And that can be very important. And kind of to wrap up everything, to conclude, I and our consortium in our publication, we think that airborne transmission is a relevant and plausible mode which should be taken into account along with direct droplet and contact transmission. So it's not kind of like only complementing what we already know, and I think that this is something that should be acknowledged. Human behavior is important, isolating the ill, avoiding crowds, places with loudspeaking, all these things that I talked about are relevant. Exposure time, physical distance, both need attention. So not only safety distance, but also the time, how long time you stay. So if you're further apart or close together, it's a bit different based on our modeling. And it's a multidisciplinary approach. So if we want to prepare for a second wave, for example, future pandemics, in my personal opinion, I think that we do need multidisciplinary thinking. So our views are limited, but we can really improve by collaboration. So thank you very much for your attention.
Professor Warren, and a lot of questions have come in for you, but we will take them together with our next keynote, if that's okay with you. So I'll ask you to stay again at a safe distance, and I'll invite you back when we heard your colleague from overseas. Ladies and gentlemen, we have the great honor to have a very well-known physician, epidemiologist. She is a professor she's also a professor at Georgetown University. She was the chief medical officer of the U.S. Coast Guard, and she retired as Rear Admiral Upper Half. It is a true pleasure and also an honor to have you with us. Can you hear us, Dr. Joyce Johnson? Can you hear us?
I'm delighted to be here this morning. For me, it's morning. It may not be morning. In fact, I know it's not morning for all of you. What I'm going to talk about is really a public health perspective and about the routes of transmission of COVID-19 and the virus associated with it. I found Professor's discussion about airborne spread especially interesting because it's probably the one route of transmission that the least is known about. And as a result of that, the more work that's done, the more we're going to be able to intervene and reduce the transmission. Okay, one of the things that I was asked to talk about, and I'll just address very, very briefly, is what is the United States government and what's going on in the US relative to regulatory actions to COVID-19 in the maritime industry. There's really many agencies and departments within the US government have some sort of involvement. There's the Centers for Disease Control and Prevention, which you've all probably heard about. Mostly what they've done is that they have a separate maritime sections that set policies and procedures. The maritime sections that are setting the policies and procedures for COVID are within the COVID area and are actually organizationally a little bit different than say the vessel sanitation program and some of the others that have done maritime work. CDC is primarily a surveillance agency, and within the US, it gets a lot of its information from the state government, reports to them. In the maritime industry, a lot of regulations regarding infectious disease involved reporting to the CDC. The Food and Drug Administration is the agency that's responsible for approving drugs, biologics, and devices. In the case of COVID, there have been no products officially approved. However, the FDA has provided a lot of what they call emergency use authorizations. And what that does is that allows the product or device to be sold and marketed for a particular use. However, when the pandemic is over, or at some point in time that FDA determines, those emergency use authorizations will no longer be effective. And the product will go through the usual process. All within the U.S. government is the U.S. Coast Guard. And I think most of you probably do any work relative to the U.S. are aware of the various regulatory actions that the Coast Guard has had relative to COVID. The Coast Guard has been involved in transporting patients to medical care. It is involved in a number of ways. They assist in repatriation of U.S. citizens and abroad. They also have travel advisories. CDC does some travel advisories as well. At the current time, or at least as of a couple days ago, they have they've identified one of the major issues and one of the major activities of the Department of State is to give grants of literally billions of dollars to many countries, primarily countries that are trying to cope with the problems that COVID has. We also rely a lot on non-governmental agencies in the U.S. For example, the Cruise Lines International Association is a group of many cruise lines and related entities that work out there to try to reassure the safety of both the guests as well as their crews. Other organizations that have an impact on the U.S. are WHO, IMO, and other international bodies, which I won't discuss because you're all very familiar with them. The primary talk or focus of my talk today is health and wellness aboard ship. And I just want to quickly define health. The World Health Organization has physical, mental, and social well-being, not merely the absence of disease or infirmity. Health and wellness affect the whole person. They're much more than medicine. And we're thinking about shipboard, whether this is focused towards cruise ships, but really the crews of any ship, health involves all aspects of daily life aboard. In terms of trying to manage health and safety, there's really two different perspectives. One is ship structure and architectural features. For example, how are things organized? How efficient is it to go from one place to another? Another big piece of it, and I think it'll become increasingly a large issue, is the airflow, based on the presentation we just heard. In addition to the actual structure of the ship, there's also the operational policies and procedures. What is it that you do? Do you require crew to wear masks or some kind of face coverings? What are your hand washing policies and procedures? Food service, all those kinds of things. In trying to develop a plan or sort of assure the future of health and safety, one does emergency planning and develops an emergency operations plan. In the midst of a crisis, as we are now, there's a tendency to have the plan focus only on today's problem. However, hopefully today's problem will only be here today. And it's really important to develop an all hazards approach and to try to think of all the possible different kinds of problems so that you can have one emergency operation plan, perhaps with different segments, but basically to focus, have a broader focus. Today, we're going to look at some of the things that might be included in assuring health and safety aboard relative to COVID-19. The primary way of reducing disease is to interrupt the routes of transmission. What do we know about the transmission of COVID-19? It's very easily transmitted person to person. We believe that because of that, we believe it probably takes a relatively low amount, low inoculum or few viral particles. Though, as was mentioned earlier, we don't really know specifically what that is. We have learned that people transmit disease both before they become symptomatic, and some people, maybe about a third, never show symptoms, and they can transmit disease during a fairly long period of time. Some people are super spreaders. They spread disease to many people. Basically, the other piece is how easily is it spread, and R sub naught, or the effective reproduction number, is one of those measures. R sub 0 for COVID is somewhere between about 2.3 and 6.6. There's a lot of variables. In comparison, the common flu is 1.2. So COVID is much more easily transmitted than the flu. At the other end of the spectrum, measles is viewed as probably the most infectious of diseases, and it has an R sub 0 of about 12. How is COVID transmitted? It's transmitted person to person, generally the respiratory route, on surfaces, airborne, and there's probably other routes of transmission. We say fecal viral particles are found in feces, but we don't know whether they are just parts of the RNA or if they're actual viral particles that could reproduce. Some other body fluids, such as semen, have the viral particles have been identified in. Infected pets. Here in New York City, there are a couple of cats that were found to be infected, and a number of zoo animals, usually cats, have also been reported. So let's go quickly through the different routes of transmission and what you can do to mitigate them, just in general and also aboard ship. Respiratory transmission includes coughing, sneezing, laughing, singing, talking, and breathing. One of the things that was actually alluded to is that the louder one talks, the more air goes through, and therefore the viral particles go farther. Singing is sort of talking plus, and so singing is even more of a problem than talking. I won't go through each of the routes of mitigation, but basically what they're for is to try to reduce the spread of those small virus particles that are in the air. Social distancing, here I noticed I listed 6 feet. In the US, we consider 6 feet. World Health Organization considers a meter. I think the bottom line is the farther away people are from each other, the less the probability of infection. There's also the hand hygiene of sneezing, coughing, face coverings. I know there's some controversy about those, but I think it's generally accepted that face coverings from an infected person help to prevent the transmission of those particles to someone else. So if you're going to reduce person spread underway, what do you do? It isn't that you focus on one particular thing, but you rather look at the entire experience of a person aboard ship. You would start with guest and crew education before you even left port, at the very beginning of the interaction. And have crew education that's crew education about reducing person-to-person spread. Social distancing aboard, hygiene, washing hands, covering sneezes, those sorts of things. There's also a need in many situations for personal protective equipment, face coverings, sometimes gloves, and others. I have a lot of caution about gloves. And my concern about gloves is that once a person puts on gloves, they assume they can do anything. And they forget that those gloves become contaminated just as their fingers were. Continued screening is also an area of controversy, and I'll talk a little bit about that in a minute. But there's issues as to what would be an appropriate screening set of policies and procedures, and also what tests to use, the frequency, those kinds of things. That's actually the laboratory screening. Other kinds of screening that can be done are temperature taking, and also there's a little more data that doing the checking pulse oxygenation or the oxygenation of the blood is also a good measure. Surface transmission. Surface transmission is getting a lot of attention, perhaps more attention than it may actually need. The virus droplets land on surfaces, people touch those surfaces, and then they touch their hands or their mouth or their face and can become infected. Toilets can also aerosolize the water in the basin, so some people suggest always covering the toilet seat. Surface transmission is really dependent upon how long the virus can live on surfaces. Some people and some studies are not all the same. There's differences in surfaces. There's differences in terms of moist environments, warm environments, cool environments. But I think we can assume probably for several days. But the most important thing, I think, is to think about the role of surface transmission. And I'm just going to, up here I have what CDC had, but I'm going to read the WHO position. And really what it does is it focuses and says that surface transmission is not the most important route. The most important route remains person-to-person spread. Basically, people can catch COVID-19 from others who have the virus. Disease spreads primarily from person to person through small droplets from the nose or mouth, which are expelled when a person with COVID-19 coughs, sneezes, or speaks. These droplets are relatively heavy, do not travel far, and quickly sink to the ground. Now that may be shown to me not so true as more work is done, but in any case. People can get COVID-19 if they breathe in these droplets from a person infected with the virus. This is why it is important to stay at least 1 meter away from others. These droplets can land on objects and surfaces around the person, such as tables, doorknobs, and handrails. People can become infected by touching these objects or surfaces, then touching their eyes, nose, or mouth. This is why it is important to wash your hands regularly with soap and water or clean with alcohol-based hand rub. But the point is, surface transmission is probably an issue, but some people want to put all their efforts on surface transmission and person-to-person spread. So on a ship, what are the different kinds of things that you do? Cleaning, sanitizing, particularly cleaning high-touch areas, hand washing, making sure that if you have tissues and other things that have touched mouths and noses, that there's a safe and ready disposable available. And if a patient has or a person has COVID-19, then some special sanitizing is needed. However, the virus is very susceptible to alcohol and most of the usual sanitizers, so it's not that much of a, so it's not as though it's difficult to inactivate the virus. Airborne spread, I won't say much about that because of the excellent presentation we heard earlier, but it certainly is the least understood. More ventilation is generally helpful, but as was pointed out earlier, if you keep the viral particles in the air, that can be counterproductive. I think we have a lot more to be learned. The role of HEPA filters, UV lights, and other things we really don't know. I think right now that we really need to focus on social distancing and put more efforts into research on airborne spread. So how do we mitigate SARS-CoV-19 transmission? And it's really throughout the entire process. It's pre-cruise activities, educating people during embarkation, keeping people as far apart and distancing as much as possible, health screening with temperature checks, a history questionnaire. There's a question as to whether or not laboratory testing is useful at that time. During the cruise, again, social distancing in all of the different ways, as well as sanitizing high touch in other areas. At port calls, be careful about during port calls, recognize that can easily be a good time to acquire disease. And then on disembarkation and returning home, it's important to be sure that if someone has becomes symptomatic or develops disease within the incubation period, 2 to 14 days from the time they've left the ship, that there's follow-up so that others can be informed through contact tracing and really to help reduce the overall spread of disease. Testing. There's 3 types of tests, and I'll just go through this fairly briefly. There's the PCR test, which is the nasal swab test, the antibody test, which is the blood test, and the antigen test, which is just recently approved. The PCR test identifies the virus. If it's positive, one is believed to be infectious. The PCR test is appropriate for individual people. The antibody test is the test that has so much misinformation about it. It's really only recommended as a population prevalence kind of test, not a test to base individual patient decisions on. And also, it's unknown whether or not detection of the antibodies really implies that the person is immune to the disease. The thing that I think is most important relative to the antibody test is because it's relatively cheap, it's very easy to do. I've seen a lot of companies trying to sell the antibody test as a way to assure that your crew is COVID-free. But the problem is that the antibody test does not have that capability. So be extremely wary of people trying to sell you the antibody test to do different kinds of things. The antigen test was just very recently approved. It's specific but not sensitive. That means that if it's positive, the person is positive. However, there's many positive people that the antigen test will not recognize. Therefore, it's suggested that it be coupled with the PCR test. Clinical considerations, again, with planning, there's the policies and procedures, looking at case finding, looking at the capabilities and equipment for the ship's hospital. And in thinking about the ship's hospital or sick bay, there's a tendency, particularly where you have a physician on board, to want to have a ventilator. One of the things that I think we need to remember is that a ventilator, as with many pieces of hospital equipment, are not individual things. They're really pieces of equipment that require an entire infrastructure to support. And it also, many physicians don't know how to use a ventilator because in their practices, they haven't used one for so long. So it's important that if a ventilator is incorporated into the system, that there's adequate training and infrastructure support so that it can safely and effectively be used should that be needed. Sort of my list of cautions here. First of all, the world has only been aware of this virus for about 6 months. What we know about it is constantly changing. For example, today we all learned a lot about about the airborne spread. There's a lot of products out there that are being made, that unrealistic claims are being made about. If someone says something can do everything, or if someone says they have a product that can solve something that no one else can solve, the probability is that it's an unrealistic claim. The Food and Drug in the US, the Food and Drug Administration and the FTC are getting an increasing number of complaints regarding SARS products and really just outright scams. So be aware of those. The future, I think the biggest uncertainty is the timelines. What's going to happen in the next few weeks, few months, few years. Most countries have community transmission. Some countries it's decreasing. We've got a lot of experiments going on with clinical trials for drugs and biologics, and a lot of vaccine research. And the more we learn about the disease, the more we'll be able to control and manage it. Thank you.
Thank you very much, Dr. Johnston, for that excellent presentation. I'd like to invite Professor Vuorinen back to the table, as it were, to ask you questions that have come from our audience, if I may. And the 2 questions that we receive come to the question of ventilation. Both, I guess it's an obvious overlap between both of your presentations. So the first question coming in from Mr. Kulmala, saying, I would be careful limiting filtration efforts to HEPA filters as they struggle with the airflow amount, which is crucial when indoor spaces are purified. And then we have a comment on the same theme from Mr. John Hemgord, who says, are there any research results or evidence on airborne transmission through UVAC, so ventilation systems, heat ventilation and air conditioning systems? So on this question, and of course, looking to this industry, is there anything we can do with ventilation that would minimize our risks? Professor.
Okay, just a few remarks on ventilation. Here we are relying part-wise on media as well, I would say, because of the lack of publications at this point. But there has been talk about this, let's say, Princess Diamond case and speculation about airborne spreading of the virus in the ventilation systems. I don't have an opinion if it did go like that or not. Then we do have practical evidence or indirect evidence that as well on airborne transmission in super spreading events, like in the Women's Day concert in Helsinki, for example. We had one of them, or the football games in Italy. Yes, ventilation is a quite tricky topic because it involves many aspects. It's a multidisciplinary problem, and so there is just technical matters like how the ventilation is in practice implemented. Ventilations are space dependent, so like every single space there is certain kind of airflow which depends on the number of persons as well, the obstacles if you have table or some shelves, that will play a role in there as well. And I think that the general consensus is that if you increase the ventilation rate, you lower the concentration levels. So yes, you kind of like put one bottle of air in, you take another one out. So in principle, the idea sounds good to me. Yeah.
Dr. Johnson, you mentioned ventilation in your presentation as well. What is your take on what ventilation can and cannot do to help us tackle this problem?
I fully agree with the professor in two ways, really, about the number of variables and about how little we really know and how complicated it is to try to address it. I think the first question addressed to HEPA filters and UV lights. I listed those in my presentation only because they're things that get mentioned. I had question marks there. I was in no way suggesting that was the solution to the problem. Relative to spread through air systems, also, I don't think we know about it. Sometimes people want to say, oh, well, Legionnaire's disease was spread through these systems. Legionnaire's disease was a totally different situation. It was a bacteria that could grow in the systems. That is not true of this virus. So in this case, the system would be a vehicle, not a true source.
I'm now hesitating between the guidance of some authorities in the U.S. and here in Europe. I don't know exactly, should I be at 1 meter or 2 meters from Professor Vuorinen? What in terms of distance, can we have a real guideline? So a meter is basically 3.33 feet. You say 6 feet, we say 1 meter or 2 meters. Do we have real guidance onto what is the real distance? What is the effective distance we need to keep from each other?
Yeah, I think that's a good one because there is some ambiguity in this sense. It all again boils down to like that the ventilation aspects and airflows, they are space dependent. So you can have a situation where air is flowing, the ventilation is arranged in a way where air is flowing from one person to another person. So in that sense, if we talk about aerosols, for example, then these would be more easily transported from one person, even longer distances. So that's challenging. Under certain assumptions, if we, let's say, think about, for example, cigarette smoke and how the smoke is diluting. This is a turbulent jet problem. And we know certain things from this. So under these, some certain assumptions, we can say that if you double the distance, you decrease the average concentration level, even by fraction half. So in that sense, I would say that the further you're away, the better it is.
Thank you. And Dr. Johnson, we also have received a very interesting question from Eric Scholbensberg, He mentions a study about the spread aboard the now unfortunately well-known Diamond Princess. A study telling us that indeed ventilation maybe not have played a role, but this contact, the contact between people, and that it was really the linchpin of the outbreak. So taking in all of these factors, where would you emphasize the risk mitigation measures that we should take aboard ship?
So I think basically that was part of the things. I think that the risk mitigation measures aboard ship would be really the same as the risk mitigations anywhere. And to approach that is to look at the routes of transmission and then find the ways to mitigate the routes of transmission.
Clear. Anything to add, Professor?
Just that indeed, like what we have found in our consortium and based on our discussions with experts from several fields, this is not like this is commonly like not black and white type thinking. It's a continuum. So we commonly have situations where you have different modes of transmission taking place all interactingly. So a person who can be like inhaling aerosols, but also like gathering and accumulating some virus from surfaces and by contact transmission.
Well, I want to thank you both, Dr. Johnson. Where are you calling in from today?
Washington, D.C.
Is it a nice day in Washington, D.C.?
You know, it's actually, there's just the right amount of overcast, so it's totally pleasant.
Well, we wish you a very pleasant summer in Washington, D.C. And Professor, thank you ever so much for coming today. Thank you. Thank you both. Thank you so much.
Thank you.
Thank you. Ladies and gentlemen, we'd like to take a poll. Given already what you've heard and, of course, what you're experiencing in the industry, we'd like to get your view on when could we expect a recovery in our industry. So there's a poll up, and the question is, when do you expect a full recovery of the maritime industry? Are you optimistic and think that it'll happen already by the end of this year, or is it B, by the end of next year or later? Take the time to answer this question, but we will not look at the results right now. We will go right into the second half of our event today, where we will look at two different initiatives at the European level. Our first speaker in this part of our webcast today is Maritime. It works for the Maritime Safety Unit of the EC Directorate General for Transport Mobility, so it's called the DG Move. Very good name. Within safe shipping and related environmental issues. He'll be talking about COVID-19 guidelines on the progressive restoration of transport services and connectivity. So, without further ado, I would like to welcome aboard Mike Schmal. Can you hear us?
Yes, good afternoon.
Good afternoon, Mike Schmal.
Hope you're all fine. Hello from Brussels. Can you see my screen?
Yes, we see you.
So what I wanted to do is to present you how we at the European Commission in the Transport Department reacted to the COVID crisis. And it all came to our attention in the beginning of February when the Diamond Princess arrived in Japan. And then more than 700 passengers tested positive. And there were a lot of, let's say, deplorable deaths on the ship. We also heard about other cases on other ships off the coast of Australia, of the Americas, and we also had some cases in the EU. Then by mid-March, the number of cases in the EU actually overtook the number of cases in China. And then the World Health Organization considered the EU as the center of the pandemic, which led to very rapid decisions by the EU member states to close down. So by the 18th of March, we had basically the whole EU in lockdown, and also member states shielding themselves from other member states, closing the borders. which is something we haven't seen in Europe for years before. So it was a really strange situation. And that also led to situations when a cruise ship would come to a port that it was very difficult for these ships to be accepted in the ports, which will also have led to the worldwide suspension of cruise passenger operations. In order to harmonize a little bit the reaction of the member states to this, we published some guidelines in April, and these built on guidelines which were released earlier on border management and called on member states to facilitate the transit of EU citizens and third country nationals who are EU residents to return home. In addition, we also have a big problem with crew changes of seafarers, and therefore in our guidelines we also underlined that workers in essential functions, regardless of their nationality, should be able to transit and travel to ensure continued professional activity. The guidelines also established a clear chain of responsibility. So the primary responsibility for also taking up the costs for any repatriation is the cruise ship operator. And in these efforts, they should be assisted by the flag states. And this was also done in order to help member states to accept cruise ships in their ports. Because if the question of compensation is unclear, then a member state will be very hesitant to accept the ship. But I think this is a principle which now has been widely accepted throughout the industry. And the legal basis for that is, as far as the passenger is concerned, in the package travel regulations of the Commission, and also in the Maritime Labour Convention in as far as the crew is concerned. In addition, we also said that if a ship is flying a third country flag, member states should accommodate it for humanitarian reasons, but it's recommended to request appropriate financial and logistical arrangements from the operator before docking. And this can include, let's say, paying for the facilities for quarantine, personal protective equipment, the organization of buses and charter flights from the port. And with these guidelines, I think we established a good basis, and from then the problems with the acceptance of cruise ships, at least in European ports, decreased. I would also like to take this opportunity to thank colleagues from the US for accommodating some EU flag vessels in their ports and helping the operators to organize the repatriation operations from there. Then sometime later, when the COVID crisis had reached its peak and was over its peak, the Commission looked at the progressive restoration of transport services and connectivity. And there are some guidelines issued on that subject on the 13th of May. And the guidelines underline that, of course, the health of the citizens, including transport workers and passengers, remains the key priority. But that, of course, it is envisaged to ease travel and operational restrictions. But this easing should be gradual in order to protect the health and ensure that all the systems can actually cope with the increased freight and passenger volumes. The guidelines set out general principles applicable to all transport services and also make specific recommendations designed to address the characteristics of each mode. And this is what I'm going to explain now for the waterborne sector. So it's underlined that measures to ensure public health will be necessary to restore the trust and confidence of passengers and crews. Therefore, the measures should be adapted to the type of the vessel and the character and length of the voyage. There may also be a need to increase the number of vessels and voyages, for example, for ferries going to remote regions and islands. It may be necessary to have more ferries in order to ensure social distancing on board. Workers should in all cases have access to personal protective equipment and adequate medical care at all times during their work. And direct interactions between persons on board should be reduced as far as possible to avoid the risk of transmission. The guidelines also stated that the European Maritime Safety Agency is ready to facilitate the sharing of best practices and information. We are also working with the International Maritime Organization, and we consider that this coordination at IMO level is very important in order to ensure an equivalence and reciprocity between the measures taken. So which measures are we looking at in particular? In the guidelines, we mentioned that social distancing should be observed on vessels. Then the access to the embarkation, disembarkation case should be limited to passengers with tickets. Also, and that is new, especially for ferries, that special seats should be assigned to the passengers. Ports should consider dedicated lanes to separate entry and exit. And when the conditions allow for it, especially on short ferry trips, as many passengers as possible should be on the open spaces, also for the reasons described by the previous speakers. In case that passengers are recommended or requested to remain in their vehicles, which some member states did actually, then such a measure for safety reasons should apply on open decks only, unless additional safety precautions are taken in line with applicable EU rules, because in general, IMO does not allow that passengers stay inside their cars on ferries in closed spaces for fire safety reasons. Other measures relate to the cleaning and disinfection of vessels, and there we suggest to follow the procedures of the EU Healthy Gateways joint action. So EU Healthy Gateways is an initiative that has been started by my colleagues from the DG for Health and involves a lot of health professionals throughout Europe who work together with industry and other stakeholders to draw up guidelines which then can also be followed by the member states. With regard to cruise ships and their relevant ferries, there should be dedicated protocols for cleaning and hygiene that minimize the risk of cross-contamination between passenger cabins. In addition, there should be protocols between ship operators and onshore facilities for persons which are actually suspected to be infected or who have the inspection. And this should include already planning for measures before, during, and after the voyage. For this purpose, health screening procedures should be available. There should be enough rooms for quarantine, and there should be also adequate interaction with the person in quarantine organized in order to ensure that persons are not just put into quarantine and then forgotten about. In addition, we also ask cruise ships to have adequate testing capacity for COVID-19 on board, which should be used if any suspicious cases are being highlighted. Furthermore, especially on cruise ships, we ask the operators to put in place strict procedures to reduce the risk of transmission on board and to provide adequate medical care in case of infections, since cruise ships are also, let's say, usually on longer journeys than ferries. So there are specific issues to take into account in that respect. We also say that the gradual restoration of services should be coordinated at EU and international level, taking into account the public health situation in the countries concerned, which means that the cruises shouldn't go to places which have a high ratio of COVID infections and then send their passengers on any excursions there, of course. And then before starting the journeys, in order to avoid the problems that we had in the past, we asked the operators to ensure with ports en route that if needed, there are arrangements for passengers and crew members to receive medical treatment, and that repatriation and crew changes can be organized. So we would expect of the cruise industry to talk to the ports of call and then ensure that in case an emergency is happening on board, that then also there can be a quick reaction and that we do not end up in a situation again where nobody wants the ship to dock. So based on this, which are some general guidelines, we recently had a meeting of the EU maritime directors together with the representatives of CLIA. And after the joint meeting, the EU member states asked us to work on a coordinated approach to the resumption of cruise tourism, which should be facilitated through guidance. And this guidance is now being drawn up by the European Maritime Safety Agency and the European Centre for Disease Control. And they are working on comprehensive guidelines. So firstly, on a guideline for cruise ships, and then secondly, there will probably be one on ferries as well, which should include shipside and portside aspects. And underneath, I have also listed some interesting non-official documents for you. So one is a link to the Healthy Gateways Joint Action, a webpage on which you can find a lot of useful documents with regard to the answer or to the reaction to the COVID crisis. And then also the guidance of the Industry Association Interferry on reopening passenger ferry services, which I think is also a very good document. So with that, I would like to conclude my presentation, and thank you very much for your attention. And I leave it to the moderator if there should be some questions and answers now or later.
Thank you very much, Mike Schmal. And we definitely will have questions for you and for your colleague from DJ Move. We will handle that together. I understand you're not in the same place in Brussels, but you're both in Brussels, and we'll be taking the questions together. If that is okay with you, please stay online. Now, we would like to take a look at the results of our poll. So, when will the maritime industry recover? And very interesting results, and we can show the results, please, to everyone. And we're looking at a minority of optimists who believe that we should recover by the end of this year at 15.6%, and then a good amount of people believe that by the end of next year we should be okay. So that's 37.5% in addition to that. But still, most people believe, or actually on its own, taken on its own, 46% or 47% of the people believe that it'll take longer. And a very good question came also in the questions, what part of the maritime industry? Well, the question was very basically, from your perspective, which part of the maritime industry you are in, whether it's ferries or bulk or whether it's tankers, when do you think you will recover? It seems, and obviously, you will recover faster if you're not in the passenger business. Obviously, we understand that. But ladies and gentlemen, we now move on to our next and final speaker for today. He's also, as I said, from DG Move. He is the program manager at the Directorate General. And his topic today will be something very important, especially since many people think that it will take us time to recover. So it's the EU relief and recovery economic measures for the maritime industry. It's a pleasure to have you with us, Simon Osilovsky. Welcome.
European Commission department dealing with mobility and transport, the same as Mike, but although different directorate. And today I will try to show some information as regards the EU relief and recovery economic measures for the, let's say, for the maritime sector specifically. However, these measures were undertaken or proposed or launched by the European Union to support all type of economic operators. But I will be a bit more specific for transport sector and for maritime in particular. So basically, there are two, let's say, main types of the measures which were launched by the European Union. The first type is so-called relief measures, short-term, just to provide immediate support for the companies, for the economic operators, for citizens, for the countries, for the member states of the European Union. And in the transport sector, it was super important to maintain the flow of freight, to preserve the supply chains, to protect crews, and to tackle the biggest problem the economic operators had, especially during the lock-in time, which is the financial the solvency issue. So this was, let's say, the first type of measures which were proposed between March and May 2020. Now, since we are trying to get out from the coronavirus crisis, it would be very important to provide also support to the economic operators for their recovery. So this is the second, let's say, pillar of the EU intervention, and this would apply rather in the medium term between 2021 and 2024. As regards this short-term economic response to the EU economy, there were a number of measures which were launched by the European Union, by all the institutions, meaning the European Commission, the Council, and also the European Parliament, together with the member states. I will not address them all today, but perhaps I will mention the most important ones, starting with the coronavirus response investment initiative, which was let's say, activate the unused money from the cohesion program. The cohesion, let's say, program is addressed to the, let's say, less developed EU member states, and it has very defined priorities. And this response investment initiative was to activate unused money and to redirect them to the most urgent needs in the member states. Then the very important measure which was taken by the EU was to provide a new temporary framework for the state aid, so that this new framework enabled to certain flexibility for the member states to launch their own programs or even as provide state aid to individual companies. And this, let's say, temporary framework resulted in a number of very different, various support schemes across the EU. That was perhaps that went hand in hand with additional flexibility in the Growth and Stability Pact. That was about the fiscal flexibility for the member states to launch their own support measures to support their economy. And all these resulted in enormous, let's say, support let's say amount across the union, because all the measures which the member states launched generated around 2.5 trillion euro. So this is enormous amount to prevent from the COVID-19 problems. On top of that, there was additional programs like SURE, so that this is support program to address the issues related to people at work, to preserve jobs. There was also the specific measures launched by the European Central Bank, European Investment Bank. So altogether, there was a package which was launched, which supported the EU economy over the last months. Obviously, there were also maritime specific relief measures. I think Mike addressed them very well in his presentation, so I will not repeat them again. I will only mention perhaps, because this is a typical economic measure, that was the amendment to the Port Services Regulation to give to the member states and port authorities additional flexibility to waive, reduce, suspend or defer port infrastructure charges in the period from the 1st March until the 31st December of 2020, until the end of the year. So this is something which would support economic operators, the ship owners, ship operators, and also terminals in the ports, which are supposed to provide to pay charges to the port authorities. As regards the second pillar, let's say EU recovery package. That was announced on the 27th of May by the European Commission President, Ursula von der Leyen. And this recovery package was included or announced together with the long-term European Union budget for the years 2021-2027. The priorities which were set out by the President are the green, digital and resilient EU economy, because that was also the idea, not to really come back to the situation which was before the crisis, but rather to use this opportunity to move forward with necessary reforms to transform the EU economy in more sustainable, more digital and more resilient. In general, I don't know if you've seen on the screen, if you see on the screen the amounts, because I have like that. If you see on the right side of the slide, the allocations, please pay attention to the row in the middle, Next Generation EU, with 750 billion euro. And this Next Generation EU is actually the recovery plan for Europe. This is on top of the regular long-term EU budget, which amounts to 1.1 trillion euro for the 7 years' time. However, this next generation, as I said at the beginning, it's rather mid-term. So this will cover the period between 2021, 2024. This money is, of course, topping up the allocations, the measures which were launched already during the relief, let's say, phase. The measures which were launched by the EU itself. I'm not counting the money, the budgets which were allocated by the EU member states. So if we count this, let's say, budget allocated for the relief at the EU level, it was around 540 billion in allocation. So this next generation and long-term EU budget comes on top. And then if we speak about next generation EU, there are three main pillars. First pillar is addressed to the member states. The second pillar is addressed to the private businesses. And the third pillar is about learning the lessons of the crisis and addressing Europe's strategic challenges. If we zoom in this next generation EU, meaning the recovery package, we can see the three pillars with some more details. So the first pillar on supporting the member states to recover consists of very specific programs, which are Recovery and Resilience Facility, Recovery Assistance for Cohesion and the Territories of Europe, Reinforced Rural Development Programs, and Reinforced Just Transition Mechanism. I will address them in some more detail a bit later, perhaps without the rural development programs, because they are not relevant for our discussion today. If we look at the second pillar, which is particularly interesting for the private businesses, for the economic operators, including transport and maritime companies, we can mention here the new Invest EU program, strategic investment facility, which in fact forms a part of this Invest EU program, and also solvency support instrument. Whereas the first pillar covers both grants and financial instruments, the second pillar is mostly on the financial instruments, meaning the loans, guarantees, and equity funding. The third pillar is about the new health program, reinforced rescue, and reinforced programs for research, innovation, and external action, which is kind of topping up of the research and development program of the EU. Altogether, around 80%, even more than 80% of the budget goes to the first pillar. Now, what would be the implications for transport and for maritime transport in particular? First of all, I will start with the Connecting Europe facility, which is the instrument co-managed by the department where I'm working. So this is of particular relevance for us. So basically, the Connecting Europe facility was proposed for the whole period of the multi-annual financial framework. So meaning between 2021 and 2027. And the Connecting Europe facility consists normally of two main parts. First is a general envelope addressed to all the member states. And the second is the cohesion envelope, which is addressed to the less developed EU countries. Altogether, they both envelopes, they amount to around 23 billion euro for the 7-year time, which is very much comparable to the current programming period. So this would be actually for us the main instrument to support transport and mobility in the next 7 years. Another very important program is InvestEU. This was created on the basis of the successful so-called Juncker plan to stimulate the investments in the EU. The InvestEU is based not on grants, it's based on financial instruments, meaning guarantees, loans, equity, and so on. In general, it can be split in two main parts. Again, the first is investing in the EU economic recovery with around 15 billion for the next 4 years. So this is the recovery part, and 1.3 billion would be for the entire 7-year period under the under the long-term EU budget. The second part of this InvestEU program is the completely new scheme, which is called Strategic Investment Facility. And it allocates around 50 billion only under the recovery plan, so under the Next Generation EU between 2021 2024. So this will be to support the most important value chains in the European Union. So we are now working inside the Commission to define some more details as regards this InvestEU budget, InvestEU program, and InvestEU scope. And we hope that part of this budget will be used really to support the transport-related projects, and of course, maritime would be part of it. We also understand that between 35 and 50% of the companies, of the economic operators in the EU may have some solvency problems at the end of the year, so financial liquidity problems, let's put it like that. So there is a new instrument, which is called Solvency Support Instrument, which is aimed to support this, let's say, very specific problems of the EU economic operators. The program has around 26 billion between 2021 and 2024, but already 5 billion will be implemented in 2020 because the solvency, the financial problems, of course, they persist already in this year, and we can expect that 2020 would be the critical year for many economic operators. The new Recovery and Resilience Facility, this is the first pillar of this recovery plan. This will be addressed to the member states, will consist of both grants and loans, and this will be, let's say, disbursed on the basis of the national allocations, so different EU member states. And the EU member states will be supposed to provide or to develop their own recovery and resilience plans, and on the basis of which the money will be implemented. Of course, this is addressed to the member states. However, of course, indirectly, the companies, the private businesses will also benefit from this budget. So in this context, it's perhaps very important to mention it there. And finally, the cohesion policy funds on top of the funds I mentioned before. The budget allocated to the cohesion fund amounts now to around 40 billion euro. European Fund for Research and Development. Sorry, I think it's end of my time. It's around 200 billion euro. So this money will come on top of this recovery. Of course, they will be implemented over the 7-year period. And of course, they will be implemented by the member states on the basis of their own operational programs. I think I will stop now.
Yes.
I think it gives you quite a good overview of the economic measures which EU is planning to launch in the coming years. Thank you.
Thank you very much, Simon, for that excellent overview of the robust measures the EU and the EC are taking to take us towards recovery. Thank you ever so much. Only one question has come for Mike during the course of both presentations. It's a very good question for Mike if you're still online. And you'll see this it comes from Yang Jing Lee, who tells us, Mike made a very perfect presentation on this topic. My question is about whether we can make international standards on this issue to help designers and operators. Are we expecting further standards and guidelines that would be, things that we can actually work with to standardize our measures throughout the industry?
Yeah, that is actually something which we would aim at in the more, let's say, medium to long term. So first of all, we have to do something quickly, and that is to get these guidelines for the cruise and ferry sectors at the European level. But we would then, of course, also present those to IMO. Maybe there's also, let's say, for certain equipment, if you think about air conditioning systems, etc., maybe there's also need for technical standards. And these we should definitely work out in the IMO framework. But also, let's say, if there could be some worldwide guidelines, let's say, of IMO on cruise, why not? I mean, this crisis has actually shown that there's a real need to go and have some universally accepted, let's say, procedures on what to do in case of emergencies.
Mike, Simon, we thank you so much for your contribution and wish you some sunny days in Brussels. Thank you so much. Thank you.
Thank you.
And now, ladies and gentlemen, we have a surprise guest, someone who has contributed over the past 5 decades to the industry. He's the grand old man of maritime, and we wanted to ask him his view. We wanted to ask him his view on the way forward and how he sees the future of the industry. And he is the former CEO of Massa Yards, Mr. Martin Sarikangas. Martin, can you hear us?
Oh, yes, I hear you very well, thank you.
We are delighted to have you online, Martin, and we'd like to ask you, we just went through recovery measures, health measures, and this is going to transform the industry you know so well. How do you see us tackling this, and how do you see us recovering from this in the future?
Well, first of all, I would remember the starting of cruise industry in 1967 when I introduced 2 gentlemen to each other. One was Ted Harrison and one was Knut Kloster. And they both had a great idea to start a new cruise line. And finally we were sitting together, and then NCL was formed. The first cruise started with Seaboard, which was an old car ferry. That followed 1 year later, 1968, when Royal Caribbean came to us at Wärtsilä Yard, and we designed the ship for them, the Song of Norway. That was the first purpose-built cruise ship. And 1973, Ted Harrison came back again, and then Carnival Cruise was established.
Wow.
That was the start. And during these 53 years, there has never been a recession in the cruise industry.
That's true.
The average growth has been 6 to 10% annually until this year, 2020. The problem for the cruise industry now is that all ships have been standstill for close to 3 months, and passengers all over the world have been very, very much aware of the problem. Now, when I hope the quarantines will stop, some cruise lines have already started. I believe that there will be a fairly long period before people again dare to go on board a cruise. Also, some cruise lines may So it looks, for a short time period, it looks very gloomy. But as you know, Andre, people have a short memory. And I trust and I believe in that. And I believe that in the same way as people are booking trips to Mallorca, etc. now, they have been suffering at home by doing nothing. So they will come back and rush back. The problem is that there is a lot of tonnage, surplus tonnage at the moment, and so I believe if the corona pandemic will end within this year, that 2021 the industry will pick up, coming close to the numbers which were 2019, but to reach a growth of 6 to 10 or 11%, which was the case before that, that will take some time. But cruise will be there, and the reason for that is that more and more people around the world have more time to spend, and especially they have holidays and they have more money to spend. And the cruise industry is one which never will die, that is for sure. And so I'm very optimistic when it comes to a little longer term than 1 or 2 years, that cruise ship will continue flourishing and people will be happy to go on cruise to, and new territories, new destinations will open up, because the market as such is far from full. It will continue to grow, but we will have a short period of slow growth, or coming back to the original number. That, of course, will also affect shipbuilding, cruise shipbuilding, but on longer term, I think we, with Meyer and Fincantieri and others, we will continue fighting like we brotherly did during the 1900s.
Thank you ever so much, Martin, for that great insight. But I must say that you are a person with a very long memory, and you definitely remember the details of 1966 and 1967, dramatic dates for this industry. We really are grateful for the time you gave us today, and we wish you all the best for the future.
And thank you, and all the best for you too.
Thank you, Martin. Thank you so much.
Bye.
Bye-bye. All right, ladies and gentlemen, we come to the end of our webinar, and to wrap this all up, I'd like to ask Ulla Lainio to join me, please. Ulla, what did you think of our webinar today?
Many thanks, Andre. It was a pleasure to listen to all the professional presentations, and we continue from here.
What are the next steps, Ulla?
Yes, Finland has reacted to the situation in an agile manner. And in fact, we are launching this week a joint offering brochure from Finland for clean and safe ships and ports.
Okay, so that is available where?
It is available on our website. And in fact, I could show how it looks.
Yeah, sure.
If I manage to. Right, I hope you can see that one online. So,
okay,
so this is brand new.
Okay. Fresh off the press.
Right, yeah, and in fact our plan is to present this more thoroughly in end August or early September, and we will invite all of you who have been here with us today to join and listen to the presentations that we have in there.
Excellent. And everybody will be getting an email with the link to these presentations. Fantastic. But I have a personal question for you.
Yeah, sure.
When will I see you on a cruise ship next time?
As quickly as the cruises will begin.
You'll be first in line.
I will be cruising.
You'll be cruising?
I guarantee.
Fantastic.
Yeah.
Thank you so much, Ulla. Thank you all for joining us. Thank you to our wonderful production team. unbelievably well done. Thank you so much, and we wish you all a very safe summer. Thank you so much.